I knew I always wanted to help people. All my friends were always coming to me for help. I kind of followed around some nurses at career day at high school and thought, wow, this is exactly what I need to do. And so I was 14 years old and kind of knew. So I explored it more and thought, and eventually I think I'd want to do something like be a nurse practitioner. So, and then when I was in nursing school in undergrad, I did my first clinical and thought, yeah, this is what I want to do the rest of my life. It's kind of funny how I fell into it because I always thought I wanted to be an ER nurse, and I did an externship when I was in nursing school. I somehow got placed in labor and delivery, and I just realized right then and there taking care of women of all ages just in labor was amazing. And then when I realized you could do women's health and take care of the whole patient when they're pregnant, when they're early in puberty, and you don't just take care of their physical being, but you take care of their emotional and mindful and sometimes their spiritual being. So, and I love that you can take care of women. I see patients from age 15 all the way up to 89, and you can take care of all aspects of women's health, and so I love that. And when I was in the women's health program, I realized how amazing that was and how many aspects of it that you can do with it. Because it's women's health and because I'm a woman, I'd say just any woman's age group, just feeling comfortable talking to me about certain things that they're unable to talk about, either with their family members, with their spouse, with their friends, with other providers. I feel like that's really rewarding that I can have women of all ages come talk to me about problems that they're uncomfortable talking to other people. Because women's health can be definitely a sensitive and uncomfortable subject. And so I think rewarding-wise for me, and that's why I love it so much, is that people, I think, can feel comfortable enough to ask questions and not feel silly and really kind of open up and, you know, ask those questions that they want to know, and they look up in the internet and they can't get a good answer. So our practice is just 2 providers, so it's Dr. Chen and myself. So as a nurse practitioner, I provide services a wide range. I do like GYN care, I can do minor procedures, anything with abnormal pap smears Dr. Chen deals with right now, so like colposcopies, but I do well woman exams, any sort of GYN issues, non-surgical. I also can do family planning and infertility, you know, young adolescent health for sure, any sort of period or menstrual cycle issues I can work with. OB-wise, I do prenatal care. I don't deliver babies, so I do prenatal care, and I see patients up until the end of their 2nd trimester. So, and then Dr. Chen takes over care. Obviously, if I'm out of the office or I'm unavailable, Dr. Chen's around. So our office works that on Mondays we're here in Progress West together, and then we kind of go back and forth different offices, different days of the week, but there's always someone in the office Monday through Friday. If you were to call as a new patient or a continuing patient from the previous nurse practitioner that worked here, you could definitely get in same day availability. I'm in the office at Progress Monday, Wednesday, Fridays, normal hours 9 to 4:30, and then on Thursdays I'm at Missouri Baptist office. Because I'm a younger provider, I definitely have some people that I walk into the patient's room and they're like, wow, you're really young. I would say that just because I've never had a child or because I've never experienced some of the things my patients have experienced, I definitely tried to immerse myself into research of it and understanding it and kind of experience it through patients to kind of understand what's going on and really be able to feel for them and kind of treat exactly how they're feeling and what's going on with them.